guys. So first you have to orient it to where it is as if it was lying in somebody else's body. So it'd be like this for me if it was lying in my body, right? So of course the apex down here, you're looking at this sulcus right here that's going to separate the right half from the left half. And these are going to be your auricle here. So here's your left auricle, here is the right auricle. So make sure you can be able to identify those. The easiest way to identify these up in the top is to be able just to stick your fingers randomly in to the different passages from the ventricles and from the atrium. Right side and left side, even if I flip this around, okay, how do I know which is right and which is left?
Left is.
So the left side is going to be my meaty side, right? Which side is the left or right? I'm looking at it here. Okay, this is going to be my left. So if I flip it around like this is going to be my left side. Okay, you know it's left because of the actual size of the ventricle down here. It is so much bigger than the ventricle that's sitting over here. And that's because the blood has to be pushed from the left ventricle a farther distance because it's going to go through the aorta and it's going to be pushed throughout the rest of the body. Versus this is going to push it only into the lungs. Okay, so it doesn't have a very far distance to go. Remember that deoxygenated blood is always going to enter into the right atrium, go into the right ventricle, and then it's going to go through the pulmonary trunk, get oxygenated in the lungs, come back into the left atrium, left ventricle, and then go out through the aorta. So here we have our right atrium here. If I stick my finger in here, I should be able, in this case, and you can see my fingers right there, this is the superior vena cava. Most of you guys cut off your inferior vena cava, and that's fine, but this is the superior vena cava. So superior vena cava are all, and inferior vena cava, as well as the coronary sinuses, are going to dump into the right atrium. Also all the deoxygenated blood. Here are your, here's your valve, your AV valve. This is going to be your tricuspid valve. It is going to be anchored. Here, you can see the little anchors here, those little string-like, their tendons are corded, are the chordae tendineae, and they're going to be attached to the papillary muscle. So wherever they're attached to down here is papillary muscle. This muscle in here, in the atrium, and both atrium are going to be characterized by this particular type of muscle right here is pectinate muscle. Okay. This is the interventricular septum that separates the right and the left half from each other. If I stick my finger in here, maybe I can find... It might be on the other side. Okay, so if I stick my finger in, and this is the right atrium again, I just flipped it around, you should be able to see the pulmonary valve in there as well. Okay, and there's the pulmonary valve on the inside, and this is going to be the pulmonary semilunar valve. It's going to separate the trunk from the right atrium. If I stick my finger in there, it should go into the pulmonary trunk, or be able to identify the pulmonary trunk for you if you need it. If I had a go-go gadget finger, that would be amazing. Okay, and you can see my finger right there, and so this is the pulmonary trunk right here. And in fact, if I enter into this area, my fingers should meet, and they touch right there. Okay, so my fingers are touching. So that's the pulmonary trunk. So into the lungs, comes back out of the lungs, enters in through a vein, and the vein is going to be on the left side, and these are the pulmonary veins that dump into the left atrium. From the left atrium is going to go through the mitral valve right here, and so here's your mitral valve. Again, you can see the chordae tendineae here, much better than you can see on this side. And then you see the papillary muscles really good on this side as well. I'm going to follow this through the pathway, and then this leads up into the aorta. And so here is the aorta. That wasn't the aorta. And that's not the aorta either. Where's the hole? This should be your... Did you guys cut it?
No.
Oh, there it is.
It's like I'm gonna want to.
I was gonna say it was there yesterday.
Ay, no sé. No manches.
Your aorta is blocked for some reason.